Hello, everyone. Welcome to our Focus Forum. We'll get started in just a minute, letting you all filter in here for this very interesting, I'm sure will be very interesting forum today. We had a great number of registrants, over 100, actually over 130 registrants. So we'll see how many are actually able to join, but we're very excited about being able to present this to you. Looks like we are slowing down and now filtering, but we will get started in just a second. Okay, welcome to our Focus Forum. For those who don't know me, I'm Rita Riker, president of Focus Greater Syracuse, and delighted to see so many of you here on this wintry day. Now sunny, or was sunny just a minute ago. I guess it's not sunny anymore. Anyway, our topic today is navigating law enforcement and the complexities of mental health and substance abuse. We have several experts who are actively involved in tackling this serious issue, and we're going to get right into it. So our first presenter today is Donna Knapp, Executive Director of the Prevention Network. Donna, please introduce yourself and tell us about the Prevention Network's involvement in this area.
Hello, everybody. Again, my name is Donna Knapp. I'm Executive Director of Prevention Network. I've been with the organization for almost 11 years. I've only been in this role for the last year. I always like to share when I'm talking about Prevention Network that I came as a volunteer, that I started working with the organization through one of our youth programs, and when my own children were involved in the program, and really felt a connection to the mission and vision of the Prevention Network, which is to implement and support strategies that promote healthy choices to prevent addictions and related concerns. Prevention Network has existed in the community for 75 years. We're celebrating our 75th anniversary this year, and we will be celebrating that throughout the year. We do provide a variety of services, primarily around substance use and misuse prevention, but we also address family support, harm reduction, as well as some recovery services as well. Prevention isn't what people think it used to be. A lot of people think prevention is just say no to drugs or one-on-one counseling, but it takes many forms in today's world. We are funded by the New York State Office of Addiction Services and Support. We have one program that's funded through the Office of Drug Control Policy. Onondaga County supports us in some of the work that we do, and it falls into a few different buckets. We have primary prevention, which is primarily what people think of as prevention. We provide education, information, and awareness resources, some referral services for individuals, small groups, anyone in the community who's looking for some assistance. That takes many forms. We do community presentations to organizations, businesses, schools, churches, anyone who invites us in. We also table in the community at health fairs, community events. Again, our goal is to try to provide factual-based information around substances, addiction, what that looks like, where resources are in the community, and how we can help. Another aspect of prevention that isn't talked about a lot is called environmental prevention, which is more of a policy-based look at prevention. How can we as a community address some of the challenges that we face with access and availability, risk factors for youth and community members? We work on small policies within organizations, how to make sure that their internal policies are up to date, that address a recovery-friendly environment for those members of their organization who might have a history of substance use disorder. And then we can also assist with larger policy change if there is a community group or a community that wants to look at something in that respect as well. We provide harm reduction services. We are an opioid overdose prevention program certified by New York State to deliver Narcan in the community. We have several of our staff who are trained to deliver that. We also have 15 naloxone cabinets that are installed in the community that provide 24/7 access to Narcan in their locations. And I will share that for the rest of 2024, through a state opioid response grant, we have funding to install 30 more. So as a member of the community, if you have an organization or an institution that you think would like to have a naloxone cabinet, we do have those available to install this year. We also have the Regional Prevention Resource Center that works with coalitions and community groups who want to address a specific aspect of substance misuse in their community. We provide technical assistance and training to community members and to providers. And we have 2 family support navigators who work with the families, because what's often overlooked in the substance misuse arena, as well as mental health, is that it's a family disease. It's a family situation, and the family members often are overlooked. And so we provide the navigation services for the family members who, one, either need their own supports or they're trying to help navigate systems for their loved ones. We'll help to provide that service as well. And we also offer a variety of recovery focused support and not 12-step, but other support groups for families, Smart Recovery, Refuge Recovery, as well as a couple others. And we are located on Spencer Street in Syracuse. We do serve all of Onondaga County, but our doors are open, and we invite anyone who wants to come in and learn more about what the services are that we can provide, which are almost all free of charge because of the generous funding that we receive from the different organizations. So that's a little bit about us. And as far as the connection with law enforcement, over the years, we have had several, particularly Syracuse police officers, who have been involved with our community coalitions that are addressing different aspects of health and safety in the community. And I think that they offer great insight to the work that we've done, and it brings value when the community members and law enforcement come together to address topics such as this. So I'm really excited to be here and hear the rest of the presenters as well as the questions. So thank you for having me.
Thank you, Donna. Next up is Jennifer Parmalee, Deputy Commissioner and Director of Community Services for the Onondaga County Department of Children and Family Services. Jen, please introduce yourself and then tell us how Child and Family Services is involved in this area.
Thank you, Rita, so much. And thank you to the Focus Forum for having this conversation. It's such a critical conversation within our community. So I'm Jennifer, and I am with the Onondaga County Department of Children and Family Services. And the way that our department is structured, I oversee all of mental health services. And that is a focus on individuals struggling with mental health, substance use, or developmental challenges. We serve as an administrative support to our community. So our job in the county is to support identification of gaps in services, and then see if we can problem solve together to figure out how we can address those gaps. A pretty significant myth that often comes up in terms of how the general public sees the mental health population is that people who have mental health challenges are more likely to create crimes. And that is a myth. We find that individuals with mental health challenges are more likely to be victimized. However, when there is some sort of violence that occurs within the mental health population, that can be very challenging and very complex. So we have a very strong relationship with our law enforcement partners, and have spent a good deal of time identifying gaps and trying to address those gaps as a community. So we have some specific initiatives that I wanted to talk a little bit about today to make sure everybody was aware. The most important thing to think about that is a thread throughout all of these initiatives is engagement, right? So really working on supporting individuals through engaging rather than just kind of this harsh, you committed a crime, you're going to jail. Clearly, there needs to be repercussions and consequences for crimes that are committed, but we also need to work to engage individuals in supporting their treatment or their recovery goals. So one of the first things that we have, one of the first initiatives I want to talk about is our 911-988 partnership. So we have partnered with our 911 Communications Center, our 988 partner, which is Contact Community Services, our police departments, our law enforcement, our mobile crisis teams, and other community partners. And we have co-located a crisis counselor at the 911 center. And this person is able to address individuals who may be in crisis, who are calling 911. And we also, we structured it so that these 988 crisis counselors can deploy our mobile crisis teams. So we have 2 mobile crisis teams in Onondaga County. One is through Liberty Resources and the other is through St. Joe's Hospital. Both are tremendous and phenomenal teams. And as kind of a subgroup, we should say, of this initiative is we now meet with all of our crisis services together on a biweekly basis to ensure that the different teams are responding with consistency to all the populations. An important piece of this is our second initiative, which is our co-response of law enforcement and mobile crisis. So we have really exciting and robust protocols where if law enforcement gets to a scene and determines that an individual is in crisis, they can call mobile crisis to come and have a mental health professional respond to the scene to support de-escalation or support addressing individuals who may be in crisis. Based on the situation. Our third initiative that I wanted to talk about is our support that we do for individuals who have emergency pickup orders. So there are emergency admissions laws within New York State that allow for what's called a 945 pickup if someone is in imminent risk to themselves or others. And oftentimes that pickup requires a police transportation of an individual to a hospital for evaluation. Now, that can also include an ambulance response, but we have found that we wanted to partner at a much deeper level with our law enforcement partners to ensure that those 945 pickups of individuals who are at imminent risk of themselves or others go really well, that they are handled in a way that everyone is safe. The individual who's being picked up, the law enforcement officers, and others. And so that oftentimes looks like bringing in our mobile crisis team for a co-response. It may look like partnering with individuals who are supporting the treatment of that person and can deliver some helpful information in terms of how to engage with the individual to do it in a safe way. So then our fourth initiative that we're really excited about is our threat assessment in schools work that we're doing. So Onondaga County has invested in training all the schools in Onondaga County, all the districts, in an evidence-based threat assessment tool and process and procedure. So that training happened in December and we're already seeing tremendous response. It's an evidence-based protocol and set of questions to help all of us from a multidisciplinary perspective. So you may have mental health, you may have a teacher, you may have a school resource officer, able to look at a situation and help determine whether a threat is credible and how to respond. The last thing I wanted to talk about, really kind of like jumping off of what Donna talked about, is that prevention piece. We have a tremendous amount of support in schools right now. Onondaga County is investing. Recently, the county executive invested over 5.5 million annually to provide mental health treatment in schools, to provide our access team, which is a family connection and a family engagement individual, and also our Promise Zone workers, which are school engagement specialists. And so it's all about supporting individuals who may be struggling and addressing their needs early on. So I think that's for the most part where we are. One thing I forgot to mention, we participate with the law enforcement agencies in Onondaga County in bringing in what's called CIT training, which is crisis intervention training for officers, to ensure that when they are responding to an individual who may be in crisis, that the officers are specifically trained in trauma-informed ways to respond. So thank you.
Thank you, Jen. Okay, Kaylee McAllister is our third panelist today. Kaylee is Director of Mental Health for the Onondaga County Sheriff's Office. Kaylee, please introduce yourself and tell us about your office's role here.
Yes, hi everyone. So my name is Kaylee McAllister. I'm a licensed clinical social worker and the mental health director at the Justice Center, Jamesville Correctional Facility in Hillbrook. I have about 8 years of experience within the jail and correctional side of it, and then about a year as the director. So a little bit about like the mental health department within the Justice Center and the other facilities. I have a staff that consists of licensed master social workers as well as licensed mental health counselors. I have a discharge planner, I have psychiatrists, and I have psychiatric NPs. Within the mental health department, our goal is ultimately stabilization of the individuals that are coming in, as well as crisis management. Oftentimes individuals that come into the Justice Center right through booking are haven't been taking their medications. They can be under the influence of various substances. So really our goal is to stabilize them and ensure that we're meeting their needs. So with custody, we work closely with custody as well as the medical department to ensure that individuals are safe and getting their needs met. This can include like suicide assessments, making sure that if someone is suicidal, that we're placing them on suicide watch and then meeting with them daily, as well as just working with the outpatient providers to, you know, if someone's going to treatment someplace, that we're coordinating with them to ensure that they're getting their medications or whatever, you know, baseline treatment that they were receiving in the community. We also have, of course, a mental health unit that can hold up to about 56 individuals. We see those individuals on a daily basis. And then the mental health team works closely with the assigned custody deputies on that unit to ensure, again, that the support and needs are being met. We also have partnerships with Crouse, who provide MAT services, which is the medication-assisted treatment to individuals in custody. So this can include one-on-one counseling, peer support, as well as discharge planning upon release. We also partner with New York Matters, which provides kind of the same thing. They can provide vouchers for medication, as well as peer referrals for continued access to services once individuals are released from custody. And then we have a newer partnership with U-Turn Health, which is a virtual support program that connects individuals with services virtually prior to the release. And then they, of course, follow them upon the release as well. And then, as I said before, we have a discharge planner. So she works pretty closely with either individuals that are already connected with treatment to ensure that they're getting their appointments for when they're to be released, or if someone is not connected to any services or supports, then services and supports are being put into place for them. That's kind of a little bit about the mental health department. Again, we just really work closely with custody within the jail to, like I said, just ensure that everyone's getting their needs met.
Thank you, Kaylee. We're going to stay right on this, but keep you both pinned and move right over to Diane. So Diane Dober is Deputy Assistant Chief of Corrections for the Onondaga County Sheriff's Office. So Diana, you know the drill. Please introduce yourself and tell us about your role.
It was easy following Kaylee because she touched on a lot of important information that I was going to share as well. I'm on my 24th year here, so I have a lot of correction, custody experience, housing, booking, our sheriff's emergency response team, transport, compliance, field training officer. I've done it across the board. Been very active in all aspects of the jail. One of the things that I have been doing since 2003 is I was an instructor for the police academy, and I actually taught interpersonal communication skills. And I can't stress this enough. It's a 3-day course that we provide our recruits. And not only do we provide it to our recruits, we also make it a annual certification training program throughout the jail. And basically it's to develop good communication techniques for the officers. We always stress that the most important thing that an officer has on them is their good effective communication skills. This is how we really truly de-escalate many situations. We want to make sure that the effective communications in the correction setting reduces violence and the need for any type of force. So we really don't want to have any type of abuse of force. We try to use our communication skills to de-escalate. And we do that actually through our mental health professionals that we do have at the facility. We use their resources all the time. In developing these techniques, we teach our officers situational awareness, looking at situations, observing, listening, asking the right questions. We talk about communication with incarcerated individuals, responding to their feelings, asking the right questions, making sure we've got the content, and then how are we going to handle their request, i.e. we're going to be contacting mental health. We're going to be doing something along those lines. We're going to reinforce good behavior. We're going to not enforce bad behavior. We're going to try to manage them the best that we can. But however, I have to stress that when communication does break down, our main goal is safety and security for the facility. As Kaylee said, in our behavioral health unit, we do have about 56 inmates that are in that housing unit. So if somebody is having a mental health crisis, we are going to de-escalate it the best we can. And we have to get them into a secure setting, i.e. their cell, for the purposes of maintaining safety for everybody else. We have civilian workers, we have school teachers, we have a lot of people that are inside these housing units, and we just have to make sure that safety is maintained at all times. One of the other classes that I actually teach is suicide prevention. It's a 2-day course in the academy. This is also something that's mandatory to be recertified annually within the Sheriff's Department. When this class is taught, we always have a mental health professional with us to teach the class as well. There's been a lot of studies out there that show that correction facilities treat more persons with mental illness than any other system in America, which pretty much makes criminal justice agencies the largest mental health provider in the United States, which is, it's a very staggering statistic there. I think one of the key to having a good balance between everything is having qualified mental health service providers inside the correction facilities. There are our go-to people. They're the ones that help reduce as much inmate staff stress. They facilitate the offenders participating in rehabilitation programs, and they oversee a lot of the programming that we have in there. One of the things that we do is anybody that comes in through our facility within the first 24 hours, and it's obviously a lot quicker than the first 24 hours. It's usually within like the first couple hours if somebody comes through our doors and booking, they're actually assessed for suicide with staff members who are trained in that. Not only does security staff train them for suicide indicators, we then, if we find any potential, we're going to be turning it over to the mental health workers that are down and booking. However, mental health also is going to be evaluating them as well. So it's kind of like a duel the minute they walk in, because it's our goal to assess them and to identify any potential issues right there when they walk through our doors. If for some reason we find that there's something that may be a potential issue with them, whether it's a mental illness, a mental health crisis, or any type of suicidal gestures or comments, we place them on a constant watch, and we put them up into our behavioral health unit, which is monitored mostly by mental health professionals up there. Their offices are up there. We also just established in, I believe, 2021 or 2022 safe rooms inside the Justice Center, and the safe rooms are rooms that have rounded corners. There's nothing sharp in there. The light fixtures, the sprinkler heads, all that stuff is modified, so there's no indication that they can actually harm themselves inside those cells. It is the policy of the Onondaga County Sheriff's Department to screen, identify, and provide follow-up referrals for incarcerated individuals that may have mental illness, and we work very closely with other governmental agencies to provide the appropriate services for these individuals. A staggering amount that I don't think a lot of people realize is we have an outside medical health provider, vendor, and medical service vendor, which is WellPath, that supplies all medical services and medication. And currently our annual bill for WellPath is $13 million to supply medical services and mental health services to the incarcerated individuals. Kaylee talked about the MAP program, which we do have. We definitely monitor everybody that comes through the facility if they have any type of substance abuse. We also have a discharge planning policy. Basically what that is anybody who's with us that's leaving, we make sure that if they have any follow-up appointments, they have access to that. They have some providers or contacts in the community when they release. And we also make sure that when they do get released, we do release them with a reasonable supply of medication. So we don't just let them go straight out onto the street with nothing. We're pretty much giving them a package of everything so that they can continue on with their treatment as they go out into the community. We also have a veterans program at our facility. We do identify veterans that come through through the intake system. And we also work very closely with the VA. And we also do a discharge planning with the VA as well to make sure that veterans go back into the community. Most of all of our interaction with the community resources is for one goal, and that is to reduce the recidivism rate that comes back. A lot of people always say, you know, why do you have these people inside the jail? It's by the time they get to us, the decision has already been made that they've been charged with a crime, allegedly, and that they have to go through the court system. So the court and everybody has made that decision that they are now into our custody, and it is our responsibility to make sure that their medical and mental health needs are met while they're at the facility.
Thank you. I'm going to turn this now over to board member Amy Rude, who's going to moderate I'm just pinning everybody. Hold on a second. Who's going to moderate the Q&A. We did receive quite a few questions from our attendees, so we have quite a few to work through. You're also welcome to add questions in the chat, and we'll do our best to address as many as possible. So Amy, it's all yours.
Yeah, thank you. As Rita said, we did receive several questions in advance of this presentation, so we'll try to get through all of them, but we'll do the best we can. So one of the questions that we received is for you, Deputy Dober, and it's from a police officer's perspective. What are the differences between a situation that involves a mental health issue and one that does not? Are there any red flags that indicate that an individual suspected of committing a crime is acting as a result of a mental health issue rather than criminal intent?
Well, that would be, again, more geared towards the road patrol aspect of it, not so much the custody aspect of it, because road patrol deputies are the ones that are going out there and assessing the scenes and making that determination as to whether or not the situation is due to a mental health crisis. And they have the resources to call in we actually do have a crisis intervention team that's in place that we can actually call, and they'll come in and they'll assess. And if they need to use a resource in the community, instead of charging the individual, they're going to do that. They're going to go that route. If they have to make that arrest, then they're going to come into the jail. So, I mean, I can't really talk too much on the aspect of on the street, like what constitutes somebody coming into jail and what their thought process is on the road patrol side of it.
Understood. Thank you. I'm happy that you talked about the crisis intervention team because we did have several questions about that. So some of the questions were, how are officers trained? Is there a specific team that works for crisis intervention? And it sounds like the answer to that is yes. How many officers are trained? How many teams are there? Those kinds of questions. And also, how is it funded?
Those are excellent questions. Again, the CIT aspect of it is road patrol. We don't actually have a CIT policy or anything that's inside of the correction facility. But I do know that our policy is that we do have a crisis intervention team members on the road patrol that are called. As far as the numbers and how many teams, I really truly don't know the answer to that, but I'm more than willing to give Alicia the answer to that, and she can post that up there because I really truly don't know that aspect of it from the road patrol. Sorry about that.
All good. Thank you.
Could I share a little bit from the county's perspective? We've supported we've supported Onondaga County Sheriff's Department and also Syracuse Police Department and some of the other towns and villages in being trained in the crisis intervention teams. We received a grant a few years ago to help train the trainers here locally. So Syracuse Police Department and also Onondaga County have trainers, and some years we have 2 trainings that are training up to like 50 people a year, and these are officers across the county. Some years we have 1 training, and what we find is that a lot of those officers end up being promoted, so they go from like road patrol to move up. And so our goal as a community is to train as many as 20% of any I guess you'd say like people who are on that day, right? So like the goal would be, let's have 20% of officers that are on being trained in CIT. We're not quite there yet, but we're working towards that. And what's really exciting is that while in the beginning it took a lot of funding to get those train the trainers up and running, the police departments now are taking up the mantle and doing that training. So it's really fantastic.
Thank you, Jeff.
Excellent. Thank you. Was there any other panelists that'd like to contribute to that question? Okay, thank you. So another question that we got was, when a 911 call comes in that it's suspected that there's a mental health issue, how is that triaged?
So I can answer from our 911 or our 911 988 work that we've recently done. If it's very clear that an individual is in crisis, and there's no weapons that are involved, the person is not actively trying to hurt themselves or hurt others, then that call can be sent over and triaged to the 988 team. If those instances, if someone's in traffic, if someone's, actively trying to hurt themselves or others, or there's significant level of like weapons involved, then that most likely would be a police and mobile crisis response.
Anyone else like to contribute? Okay, so I know we talked about the Narcan vending cabinets. We did get a question about how to get one. Is that information that is easily available, and can we reshare it now?
I put in the question and answer area who to contact at Prevention Network to have a Narcan cabinet installed. Jennifer's team at the health department also has naloxone cabinets available. And for us, it's just simply a reach out. If you're interested, we can provide the information. Some of it is available on our Prevention Network website as far as how to do that. And they look very similar to like the AED cabinets. They're installed. They have 6 or 7 blue bags that contain 2 Narcan doses in them. The instructions are there on how to administer it, and people can take them as they need them, or what we have found has been a benefit of the cabinets is, unfortunately, there's still a lot of stigma around all of these topics. And particularly for loved ones, if they want to support someone in their life who might have a substance use disorder, that there's that stigma attached with asking for Narcan, whereas having the cabinets available in the community, they can get that protection and safety of having that available in case they need it by simply going to one of the locations where they're available. So, you know, is from our perspective, that's all that's needed, is to reach out and let us know what you would need, and we'll work with you to install a cabinet, provide the Narcan, and stay in touch with you for any education needs and support as well.
Excellent. Thank you so much. I just put that information that was shared in the Q&A in the chat so that it is readily available for everyone that would be looking to have a Narcan cabinet installed. So that information is in the chat if you are interested. And there's both an email address and a phone number there. Thank you. So a person just wanted to know, what do the day-to-day tasks look like for a social worker that works in law enforcement?
So, I mean, I think it's a little bit different in-house versus the social workers that maybe, you know, do mobile crisis and work alongside law enforcement out there. I think, as I said before, in terms of the social workers in the Justice Center in Jamesville or Hillbrook, it's a lot of just meeting with people, trying to identify how best we can get them through their current incarceration. We do just a lot of assessments, just provide just kind of support. We're not there obviously to do therapy, but just providing the support that we can for them. And then, as I said before, the stabilization, we really want to get people as stable as they can be, because we know that I think statistics show that people are incarcerated for less than 28 days typically. So we're kind of just triaging them and getting them what they need while they're incarcerated, and then, you know, working to get them back out in the community. So, like I said, I think it's just a little bit different in-house versus maybe the social workers that are working with law enforcement out on the road.
Thank you. So another question came in, and as we think about these issues, what support is there in the community for families that are that have family members that are dealing with these issues, and what community resources are available?
On the substance use side, there are several organizations, including Prevention Network, that have family navigators in some capacity or another. Our family navigators are non-clinical. They provide the education, resources, and assistance with referral to more clinically based if needed, or financial, whatever kind of supports the family might need. That's what our family navigators engage in with family members. I know that there are also similar positions in some of the mental health facilities around the county. And the problem with so many of the topics related to this with substance use and mental health is that, myself included, in the community, you don't necessarily pay attention to what those resources are until you need them. And then it's overwhelming to try to figure out where to seek assistance. And so my suggestion is just, you know, reach out to any of us on this call, but to simply engage. 211 is a great resource that can point family members in the right direction. And I think that what I have found to be one of the greatest changes in recent years is there's definitely more willingness to collaborate across different systems and providers to work with families to get them the assistance that they need. Again, as a non-clinical provider, we're a first step. We need to be able to engage with the rest of the community in order to offer those resources to family members. So 211, us, health department, any of those are great places to start, and we can point you into the direction of other providers who have what might be needed.
Can I also just share just a reminder that the crisis line 988 is now available nationwide, and the line is meant for anyone who may be experiencing stress even or crisis. So as a family member, oftentimes we aren't acknowledging our own level of stress or our own level of crisis that we may be experiencing while trying to support our family member. And so 211 is fantastic to support you in thinking about what services you have available. And as a reminder, 988 is also available to you as a family member if you're struggling. Just want to make sure to put that plug in for 988.
Excellent. Thank you so much. So an interesting question that we got for Donna and Jennifer is, as someone who oversees community services, what initiatives or programs do you think could be put in place to provide better support to law enforcement officers who are dealing with mental health and substance abuse issues in the community?
I can start. I think this is a significant need that we've identified this gap as a community, and we're putting some thoughts together in terms of how to respond. Some of our traditional supports and services don't necessarily reflect or are adapted to understand individuals who are on the front lines and may have a significant level of trauma experience. You know, just day to day going to work, you are exposing yourself to, tremendous crises every day. So, we do try to build out our mental health system so that it's, fully available and accessible to all individuals. But I think that we've identified as a community, we need to think about specific best practices that we need to identify for this population. I know that there are state level resources and some federal level resources, certain hotlines that are available, and we can try and find those and get those to you, Amy or Alicia, to put out to the team. But locally, we do need to do more.
Any other panelists want to contribute on that?
Jennifer hit a lot of the main points, and a lot of it being that there's still room to grow and ways to improve. I know as a community-based organization, one of the challenges we face is that we need to be invited to assist, that we can't just go knocking on doors and say, hey, what do you need from us? We really need to be invited in. With that comment is that with our charge and with our basis in prevention and working on strategies to address these topics, is that we use reliable, vetted, evidence-based practices in the work that we do. And so you have a thought, this might be a great topic for there to be education or support provided on, that I think most organizations that work in this arena would say that they'll work with you and that they'll custom tailor and help create what those needed trainings, resources, support, whatever it might be. But we need that ask. We need to, people to reach out and say, I think we need this, and then we'll help.
Great, thank you. We also received a question asking what the process looks for from a law enforcement perspective. If someone comes into custody and it appears that they're having a mental health issue, what does that look like? Are they assigned a social worker? Are they transported to CPEP somewhere else? What's that look like for a person?
So as we talked about before, every individual that comes in through the booking department is assessed by mental health, by medical, and then as well as by custody. In terms of if someone is experiencing a crisis, we can determine if they need to go to CPEP. I can tell you that it doesn't usually happen too often, just because now that they're in custody, we just really work to, again, go back to assessing their safety. Where best are they going to be housed so that they're safe and that we can work with them. But we have also what's called like a 730 examination that can be done. It's not meant to provide treatment to the person, but it's assessing kind of their capacity to follow through with their legal proceedings. So that's kind of another avenue that we take. Yeah, I mean, again, I think once they're in custody, it's really up to mental health, medical, and custody to, again, just work with that person to make sure that they're safe while they're in custody.
Thank you. We have just about 5 minutes left. So I'd like to give each of the panelists an opportunity to address anything maybe we haven't hit at this point, anything that you think is critical for this discussion and that the attendees should know. I'll start with, we started with Diane, with Donna. Donna, anything that you think that the community should know that we haven't talked about already?
I was chatting with my team members here at Prevention Network this morning, and one of the things that I think that we feel is important to realize is that mental health and substance use situation can change in a moment, and that we can put all of the supports and training and best practices in to the community. And there's always going to be those moments where the situation is going to get out of control because mental health and substance use is unpredictable. Every person's going to react different. And just that understanding that these are significant diseases that people are dealing with, and that there's no easy way to address a lot of this. And that's why these conversations are so important, because every type of conversation like this brings little nuggets of more information to people to sort of digest and understand the significance, and that, you know, that it's challenging topics that we're talking about.
Jennifer, anything that you'd like to include?
Well, I really appreciate that, Donna. I think due to this complexity, it makes us so challenging, and it takes all of us. So I'm very grateful to Focus Forum and all of you who came here today thinking about this, want to talk about it, want to see how we can make this better. I feel like every room I walk into, there's a dedicated group of individuals who want to make the situation better. So I think that's a bright spot in this work.
And Diane and Kaylee, anything you'd like to include?
I mean, to kind of piggyback off of what Jen said, I think there's even, you know, within the facilities, there's always room for improvement. And, you know, I think we're seeing a lot more individuals that are mentally ill, and, you know, just kind of navigating that and working with, like I said, everyone that's in-house and trying to navigate those situations.
Just from the correctional point of view, that, you know, I think every effort needs to be made outside in the community to prevent these individuals from coming into our facility. We do our best. I think we do an outstanding job, to be honest, in identifying and treating these individuals who are coming into our facility. We've got some great staff, mental health, security staff, everybody that works really well together there, and I give them a lot of credit for doing what they do on a daily basis. And I just think as we move forward, just more stuff hopefully will bridge the gap between the community and them coming in to see us. And hopefully some of the stuff that we do can help with the recidivism rate, putting them back into the community successfully, so that they do get continued with their treatment.
Thank you everyone so much. I am going to pass it back to Rita.
I'm here. There I am. I just want to thank so much our panelists, Donna, Jen, Kaylee, and Diane. I learned so much today, and just wanted to say thank you for that. So appreciate your time. We know you're all very busy people. So as with all forums, this one has been recorded and will be within the next few days uploaded to our website. If you would like to send anybody there if you would like to review again what was said, I think there's a lot of important information here that people will find very useful. Also on our website, an easy way to donate to Focus, and a donation of any amount is greatly appreciated. So beyond that, looks like the sun's back out. Have a great Friday. Have a great weekend. And thank you so much. Take care, everyone.